Hello, everyone. Welcome to this information session on monkeypox with Worth a Shot. My name is Meher Grewal, and I'm the founder and director of Worth a Shot. We are a global nonprofit organization working with a mission to make public health a priority, bridge disparities, and promote healthcare equity through community education and empowerment. And today I have here with me my colleague Louise Martins, Director of Operations at Worth a Shot. And today's webinar is focused on informing the community about monkeypox and answering relevant, commonly asked questions. So we are very proud to have with us today Dr. Seema Abbasi. Dr. Abbasi is a pediatrician with training in infectious disease and vaccine research. She has been part of the Public Health Seattle King County Minority Outreach Team with a focus on COVID vaccine education and access. She's a member of the Washington chapter of the American Academy of Pediatrics and on their Back to School Task Force and Vaccine Committee. And she has worked extensively at the grassroots, local, and state level with a global health focus on childhood infections. Thank you so much, Dr. Abbasi, for joining us today.
Yeah, glad to be here. Thank you for inviting me.
So, Dr. Abbasi, let's get started with the question. So, what is the monkeypox virus? Is there an animal to human transmission? Can you give us a brief overview?
Yes, sure. So the monkeypox virus is part of the same family as variola virus, which causes smallpox. Monkeypox symptoms are actually similar to smallpox, but it is a less contagious disease and it causes milder symptoms and is less likely to cause death as compared to smallpox. So monkeypox virus was first discovered in 1958 when there were two outbreaks of pox-like illness in colonies of monkeys. And even though it has been named monkeypox, the source of the infection still remains unknown. So we know that there are animals like African rodents and monkeys which do harbor the infection, and they can give the infection to humans. So we know that much. The first case of human monkeypox was actually documented in 1970. And before this current outbreak in United States and Europe and other countries, there have been ongoing infections, mostly in Central Africa and Western African countries.
Thank you, Dr. Abbasi. So, how is the virus transmitted? Are there certain populations who are at greater risk?
Yes, so monkeypox can be spread to anyone, and it is usually through close, prolonged, often skin-to-skin contact. So there are three primary sources of infection. The most common is direct contact with monkeypox rash or scab, as that might happen during sex, hugging, kissing, massage, etc. Then the other route of transmission is through touching objects or fabrics like clothing, bedding, towels, and surfaces that a person with infection might have used. And we also think that contact with respiratory secretions of the infected person can also cause the infection. We're just not sure at this point how often that happens. So a person who has monkeypox can spread it to the others soon after they develop the symptoms until the point all of the skin rash is healed and scabbed over and new skin is formed. And that normally takes about 2 to 4 weeks. So a person who has monkeypox may remain contagious for a long period of time. So besides these common forms of transmission, we also know that a pregnant woman can transfer the infection to her newborn. We also know that it is possible to get the disease from infected animals, either through the bite, the scratch, or handling the meat or eating the meat of an animal which has been infected with monkeypox. So far, about 99% of cases of monkeypox have been in men, and 94% of the cases have been in gay, bisexual individuals or men who have sex with men. But having said that, I still wanted to, focus on the point that anybody who has close contact, especially skin to skin contact with an individual who has monkeypox, can get the infection. So nobody is immune, in other words, at this point.
Thank you, Dr. Abbasi. So can you please talk a little bit about the clinical characteristics of the monkeypox infection?
Yes, absolutely. So the most common symptom of monkeypox is a skin rash. And this rash usually develop on the face first, but in most cases, but it can involve the private areas, anus, chest, face, mouth, hand and feet, including palms and soles. The rash goes through multiple stages. So initially it appears as a pimple or a blister, which can be painful and itchy. Later it scabs over before it heals and a new skin is formed. So the other symptoms of monkeypox besides the rash are enlarged lymph nodes. A person may have fever and chills, body aches and exhaustion, and sometimes respiratory symptoms like runny nose and cough. So some people might have these flu-like symptoms before the rash appears. For other people, rash is the first sign of infection. Symptoms generally start about 3 weeks after exposure to somebody who has monkeypox, and the total duration of illness, as I mentioned, is about 2 to 4 weeks. So it is a prolonged course.
Thank you, Dr. Abbasi. So I will now hand it over to Louise for the next two questions.
Dr. Abbasi, so how is the situation in monkeypox going in King County?
So in King County, as of August 24th, there have been about 310 cases of documented cases of monkeypox. But we have to keep in mind that there may be cases which are not being diagnosed, people either not realizing that they have it or people not going to a provider to be tested. And I also wanted to mention that within the last 2 weeks, there have been a case documented in a 4-month-old who's being treated right now. And that child possibly got it from one of the caregivers. So that is the situation right now in King County.
And regarding with the testing, like, can you please talk about like how the testing is currently available, and like how can folks get tested, and like what are the turnaround rates for people who do get tested?
Yes, yes, absolutely. So there is a reliable test available for monkeypox. It is a PCR test, which is highly sensitive. And the best way to test for monkeypox is by swabbing the lesion or the skin rash. And that swab is then sent on a special transport medium to the laboratory to be tested. Many laboratories in our area are doing this test right now, so it's quite easily available. The turnaround time is about 24 to 48 hours. So if a person thinks that they could possibly have monkeypox or may have a rash that they want to be checked for, and if they do have a personal healthcare provider, then they should go to them for evaluation and testing, because most clinics are doing this test. However, those people who may not have a personal healthcare provider may go to an urgent care clinic. Testing is also being offered through the King County Public Health Sexual Health Clinic, which is across the street from Harborview Hospital. And if somebody doesn't know where to go or how to approach testing, there is a 1-800 number, and I'll give it out to you. It's 1-800-756-5437. So let me repeat it, 1-800-756-5437, which is the Community Health Access Program for uninsured people. So that's another option, and they'll walk them through the process.
Thank you, Dr. Abbasi. I'll pass it over to Meher now.
Thank you so much. So, Dr. Abbasi, is there a treatment available? If so, who would be a candidate for treatment and who can prescribe it?
Yes, so that's a really good question. Most cases of monkeypox are mild, they're self-limited, and so they do not need any treatment. However, people who may have severe disease, especially people who have underlying immunodeficiency, people who may have a skin disorder, including eczema, pregnant women, breastfeeding women, or children under the ages of 8 years, Those are the individuals who are at a higher risk for more severe infection, and they're the ones who should seek treatment. So currently, there is no specific treatment for monkeypox. However, medications which are used for smallpox, like T-pox, which is an oral medication, and also immunoglobulin, that is available for treatment and can be effective in individuals who need it. These prescriptions can be provided by any healthcare provider, and they are free to individuals from the government through the Strategic National Stockpile.
Thank you, Dr. Abbasi. So can you please talk about the vaccine? What are the eligibility criteria for that? And do we have it here in Seattle? So what does the availability look like here in Seattle?
Okay, so there is a vaccine. The vaccine that we're using for monkeypox right now is a Jynneos. It's called Jynneos. It's available in Seattle. It's available in King County. It is a two-dose series which is given about 4 weeks apart. So you get one dose, 28 days later, you go back with the second dose. And it's 2 weeks after the second dose when the person is considered fully immune or protected from monkeypox. So currently, this vaccine is not recommended for general public. It is available in limited supply, and it is mostly recommended for communities where monkeypox is circulating right now, which is men who have sex with men and those who live in transitional housing, amongst some other groups. Also, if the vaccine is given within 4 days of exposure to monkeypox, it can prevent disease. And if it's given between 4 to 14 days from exposure, it may not prevent the disease, but does decrease the severity of infection. So that is called post-exposure prophylaxis. So that's another option available for individuals who think that they may have been exposed to monkeypox and close contact with somebody with monkeypox. So this vaccine is currently available through King County Public Health Sexual Health Clinic. It's also available at Seema community health clinics. And there are also ongoing community vaccination events. And information about that can be obtained from the King County Public Health website.
Thank you, Dr. Abbasi. So can you talk about infection prevention? How can we prevent the infection from spreading?
Yes, that is a great question. So I think the most crucial aspect for anyone is to know the signs and symptoms, and also to know how the infection spread and how we can protect ourselves. So as I mentioned, anyone who is exposed to the disease is at risk of getting it. So that's a really important thing. So, and information like this can also help people make informed choices to avoid situations or places where monkeypox can spread easily. Also, if a person has some suspected symptoms, especially if the person has an unexplained rash, then they ought to get it checked, and until then to avoid any close contact with others to keep it from spreading. And as we discussed, there is an effective vaccine available, but it's in limited quantity right now. So if an individual who might be part of a community where monkeypox is spreading right now, they should consider getting the vaccine. And anyone who's exposed to infection might also consider getting the vaccine as soon as possible if they are at higher risk, and especially if they think that they can spread it to others. I think those are the main protection points. Also, just general good hygiene measures, like when you go out, washing your hands, and then keeping all those measures in mind, especially in congregate settings. I think that those go a long way in protecting us from a number of these different infectious diseases.
Thank you, Dr. Abbasi. And our last question is monkeypox seen in kids, and especially if kids go back to school, or is there anything that they should be aware of?
Yes, I think there are two points here. So right now, the infection rate in kids is very small, and most of the time when they get it, it's actually from a close contact with a caregiver. But one thing to remember is that monkeypox, kids are the group where the monkeypox infection can be, or disease can be, more serious. So it should not be taken lightly. And the other aspect of it is that, monkeypox looks like a lot of other infections that we see in kids. So infections like chickenpox, infections like some enteroviral infections, the herpes infection, and molluscum, they all produce similar kind of rash. So if a family, a parent or a caregiver see a suspicious rash on a child, a rash which is unexplained, I think like it's important to get it checked out. And it may not be monkeypox, it may be one of the other viruses that children routinely get. But I think the key is to make sure that it's one of those that doesn't require any other further care or treatment.
Thank you so much, Dr. Abbasi, for this wonderful and informative information session, and a big thank you from Worth a Shot. I know these answers are really much appreciated by the community. We have so many questions and concerns from members of the community. So thank you so much, and thank you again.
Thank you, Dr. Abbasi.
Yeah, no, thank you so much to both of you for